Can you please tell me about any leadership positions that you've held in the past?
Yes. So during my it was my which experience was this? It was for our community health hours. So my school ran a COVID clinic, and I was always volunteering there just because it was a quick way to get hours for me, and it was convenient. And during one of the days I was there, I was working with another older nurse who worked for the company, and the CEO was there, and everything was pretty slow, and it was all just a regular normal day. The CEO left to grab lunch, and then it was just me and the older nurse, and it was my classmate there too, who just started. So I was kind of training them along the way. Then a few minutes later, like a huge rush comes in of like 10, maybe 25 people. And that's where I kind of had to take the role of teaching them along the way, but also kind of doing my job of signing them in, giving them the nasal swab, and then putting in the tube containers along with working with the older nurse. I just did my best to stay composed under pressure, even though it was a lot of stress. I just did the best I could in that moment. And it was a lot of multitasking for helping out the older nurse and then training the new nurse at the same time when the rush came. But overall, I think we did a good job.
Okay, cool. I like this. Yeah, because I kind of picture you like taking on a student while also being like short staffed, or like I
Yeah.
can kind of picture like how that would escalate later in your career. Okay, cool. Can you please tell us where you see yourself in 1 and 5 years?
Yeah, so in 1 to 5 years, I think starting off, I just would be open to working anywhere, get any experience. Preferably, when I did the interviews, I always chose med surg just because I thought that was a good foundation to start all of my nursing skills and kind of like just have a foundation of knowledge of all the conditions and everything. But I think in 1 to 5 years, it would either be becoming ICU or ER nurse because of the high acuity, and I want something more of a challenge from med surg eventually if I move on from there. And also from the back of my mind too, I think I wouldn't mind being a clinical instructor or a professor for nursing students. I always thought that nursing school was hard as it was, especially in COVID, but I think since going through that experience and realizing how hard nursing school is, I think it would be a great fulfillment for me to make it as easy as possible for future nurses because they're going to be running the hospitals one day too. And I think I would just have a great enjoyment from doing that.
Cool. So what you said is fine for if you're going for a
Mm-hmm.
float pool that includes ICU and emergency department. You wouldn't want to say that you want to start in med surg.
Yeah,
Yeah,
got
I
it.
mean,
Just tailor it to
tailor it.
whichever. Yeah, I
Yeah.
got you.
So from the hiring manager's perspective, it helps them if you say that you want to be like a preceptor someday or a charge nurse,
Mm-hmm.
because it helps them with like scheduling. They have more
Yeah.
flexibility with you.
Mm-hmm.
Um, you can also say that you want to be um, like you want to get any kind of certifications
Mm-hmm.
that would be appropriate. Um, the reason they care about that is it helps them get like magnet designation. A higher
Oh, okay.
percent have
Got it.
certifications. Like ICU has like CCRN, which is like critical care. Um, and like ICU nurses, sometimes they also get like the ECMO or like the continuous
Yeah.
dialysis certifications and stuff. So you could just say like that you'd love to get any
Okay.
certifications that would be helpful. Oh, you could
Okay.
also say you'd love to join any committees. Can you tell me about a time when you collaborated with others? So this is like an example
Yeah.
of teamwork kind of thing.
Okay. Time where I collaborated with others. So I would say one of the time I collaborated with others where it was a time where the unit was short staffed, and it was me and my classmate. We kind of got in the unit and realized how short staffed they were because of COVID and everything. I think what happened was we didn't really have a nurse to shadow. We were kind of more of the take vitals for all the rooms and let let the nurses know if they need anything. So I guess the teamwork in that was to listen to the nurses if they need anything delegated, or just to be communicative and going to the charge nurse and back to the patient, or the nurse and the patient. Of course, we had like the walkie-talkie like microphone things, so I could say like it was just quick communication to get whatever's needed done. And there are a lot of patients and not a lot of nurses.
Can you please tell us about your biggest strength and weakness?
So I would start by saying like my strength would be the time management because of COVID, and flexibility and adaptability. And I would say like on the nursing floor, because of our limited COVID experience, I would always try to like just be a sponge and learn as much as I can, say yes to every experience that I could do, and to always just keep an open mind, because even though there's like a lot of interventions and there's many ways to do it, it's important to just keep an open mind because every nurse can do something differently. Um, I'd say my one of my weaknesses would be if I have like a bad day, or like say if a patient like passes away, I could take that emotional baggage home, and it could affect the rest of my day. But I would also say like that ties into my strength because I've learned the importance of like self-care, and it's important to debrief with somebody, whether it's a classmate or your parents or a coworker. I would say something along those lines.
It's important to do what now?
To like debrief with somebody to let
Oh,
them know how
okay.
you're. Yeah, I would say something like
Um,
that.
that's fine. Just kind of make it sound like it's a problem that like you used to have, but
Okay,
like you found something that works for you.
got it.
Yeah.
Okay.
Just because that you don't want them to think like if you have a patient that like has to go to ICU or something, you're gonna be like out of the game for the rest of the shift, you know?
Hmm. Okay.
Um, can you tell me a little bit about what your hobbies or your self-care looks like?
Yeah. So my hobbies and self care. One of the important things to me right now that I recently started taking more serious is going to the gym. I always think that, well, for one, I think it's important to take care of your physical health, but I think it's also important because it's a big mood booster for me. And as for someone who like deals with a lot of like anxiety, or like anytime I'm stressed, I always have that as a resort for me to just de-stress and focus on the task at hand. And I would think it's important in a sense that having those hobbies of gymming, talking with friends, going out to eat, it's although it's like relaxing and everything, I think there's a bigger importance in that because self-care is important, in a sense that you can't take care of a patient as efficiently as you can without taking care of yourself first. And sometimes I will feel guilty for taking days off, or just relaxing, but I think it's important to realize that I need to listen to my body, and I can't do my job as best as I can without taking care of myself.
I like it. Just don't make it sound like, because I'm wondering like, oh, does that mean like, and by the way, in like real life, it's totally acceptable to just take like a mental health day where you're like, I can't do this anymore. I
Yeah,
need a day off. Like
yeah,
I'm getting really grumpy. But managers like so when we're short staffed and someone calls out, everyone goes to the manager and be like, why aren't you hiring people? Like we can't keep functioning like this. And then they're like, oh my
yeah,
gosh, so much pressure. So like don't make it sound like you're just gonna be like calling off.
yeah.
So say it, but just avoid saying like that it would sound like you would take a day off for mental health, even though in real
Mhm.
life, I 100% support that.
Yeah, I know what you
Yeah.
mean. Okay.
Yeah. Oh, and by the way, with this question, it's not like a deal breaker if you don't, but it's a good opportunity to like make sort of a human connection with them and make them laugh. Like if there's something silly that you like I don't know, there was a guy who said he's into fitness and he likes finding like healthy donut recipes, or like there's a girl that said she likes like
Mhm.
doing karaoke with her mom, or like something where it's,
Okay.
you know what I mean, where it's like kind of endearing because it's like quirky, or like a little bit silly. Is there anything like that that you could tell them where they're like, oh, it's the donuts guy, I liked him?
Okay, let me think. I feel like I don't have anything like super funny, but I have something I guess would be memorable.
Okay.
Um, I guess basically like, when I was like filming and before I became like nursing major and everything. I would film like NFL workouts, and then through nursing experience, I kind of wanted like a way to like have a positive impact on others outside of nursing care. So one of my ideas was to start like a mental health podcast, and I wanted to like include like the NFL players I filmed for. I wanted to include nursing students, high school students about like the struggles that they go through. So I think that would be like maybe it's not funny, but it's something that can
No,
really
yeah,
relate
that's
to.
cool. I like
You know
that.
what I mean?
Can you please tell me about a time when you had to adjust to a change at work?
Just to a change at work. Um, I think I have a story for this, but it's kind of like, well, I think I could say it. It was just a change from like my previous experience to like, or like say like my last shift to like the next shift. If that makes sense.
Okay.
Would okay. So basically, like I would say, it was my first time, my first shift at the hospital, and I had a great nurse, and it was a good experience. She let me do everything, and it was just like, oh, okay, like I'm a student nurse now. Like it felt great. And the next shift I had a nurse who kind of left me, kind of abandoned me, didn't really talk to me, and was kind of just like the not student friendly nurse. And so what I did was I kind of like sat down with them during like their downtime and said like, hey, like I don't know like if you had a student before, you had a bad experience, but like I'm here to learn and I don't want to get in your way of your job or anything, but I would appreciate it if you would just take the time to explain things for me, even if I can't do it, if you're not comfortable with me doing it. I would just be grateful if you could like just explain things and walk me through it. And I don't know. Yeah, that's basically something around those lines.
Yeah.
I remember without work.
Um, so we were talking about the question adjust to a change. Um, you would have to like address the question in it. You could say like, it was a big change between one shift to the other, and I had
Okay.
to just kind of like, what would you say? Like, I had to learn how to work best with like different kinds of preceptors
Okay. Got it.
and like
Because
kind of
just put
respect
the
their
question in the
style.
answer. Okay.
Yeah.
Got it.
Just because they'll be like, that didn't answer my question. You have to be like, yes, I
Yeah.
did because this.
Technically.
Yeah. We have a lot of great candidates. Can you please tell us why we should pick you?
So I think one of the strongest reasons why you should pick me is because when taking care of a patient, I look at it as a holistic perspective of taking care of their mind, body, and their soul. So of course, there's the physical aspect and their plan of care from the physician, but I always feel like there's the mental aspect of it. And I feel like for me, I would always like to take the time to not only treat my patient as a patient, but to treat them as a human being, to treat them as a friend, and take it as an opportunity to sit down and get to know them because the hospitals can be one of the worst days of your life and it's probably not the happiest for a lot of people. So I think it's important to empathize what they're going through, get to know them. If they don't speak your language or if they don't speak English, I think it's the little things about learning how to say hi in their language. How are you? And I would just take that time to just make them as comfortable as possible because I know it's probably a tough time for them.
Okay, cool. Can you please tell me about a time that you had some sort of miscommunication? Another way I've heard this asked is, can you please tell me about a time when you communicated something that was not received?
Communicated something that was not received. Let me think about this
Or
one.
like a time, like an easy, like low hanging fruit for this is like a doctor put in an order and you had to page them and be like, did you mean this
Okay.
or no?
Um,
Let me know.
I try to think. Um, I would say, hmm,
Or even like a preceptor asked you to do something and you were like, just
not
to be
clear on
sure,
it.
this is what you're asking me to do.
Uh, I feel like I have a story. I just need to think. I'm sorry.
No, it's okay. um this is one of those like curveball questions where you would be like, I can't think of anything right now. It's a good question.
Mhm.
But
Okay.
what would be important for me would just be, I feel like what's really helpful with those kind of situations is always having closed loop communication, just to
Okay.
verify that I understood what they were asking. Because I feel like clinically, there's really not a lot of room for miscommunications if I want to keep my patients
Do you
safe.
want me to answer it in a way that if I didn't have a story on the spot, that
Yeah,
what I would do in this? Okay.
yeah, just
So if
like
I would
throw out some
ever,
stuff, you know?
okay, so if I ever had a time where I would have a miscommunication with my nurse or physician, I would relay the message back to them to ensure that's exactly what they meant, having the closed loop communication and recognize the importance of the advocacy for the patient because any miscommunication can interfere with their plan of care, their treatment, and the goal at the end of the day is to give them quality care. I would say something along those lines.
Yeah, that's perfect. I love it.
Okay.
Can you please tell us about a time when you had to be creative or innovative at work?
Creative or innovative at work? I think creative or innovative at work. Mm,
What a lot of people go for with this is like COVID had to make people get creative with like so many different things. Like you could talk about how you had to get creative with like getting clinical experience. You know how you talked about that a little bit before.
oh, okay. I think I have one. Thank you for giving me that example. So during my last semester of nursing school, there were still a lot of hospitals still strict on not allowing students to precept in their hospitals, and they're just my school was trying to find ways to get us preceptors, but there's no guarantee that we'd graduate without them. So during my critical care experience, I handwrote notes to all the units and gave it to the charge nurses to say like, "Hey, I'm a nursing student. I'm looking for a preceptor, and if anyone's willing to precept me, I'd be like grateful for that. And like no worries if not, I'm just gonna keep asking." So I gave it to all like the charge nurses on every unit that I went to because I was kind of getting desperate at that point because a lot of people in my class didn't really have preceptors yet. And how I got my preceptorship at the end of the day was one of the nurse I was with during my clinicals. I asked him, "Oh, like I'm having trouble finding a preceptor. Would you be willing to precept me if it's possible and if you be, if you're free to?" And then he would say, "Yeah, like definitely just get the paperwork set up and everything." So for me, it was just taking the initiative and getting creative and thinking outside the box that if my school can't do something, what can I do in my power and my control? So I guess that would be my story.
Cool. I like that.